And welcome back to the doctor's favorite list of the top 5 ways to avoid the doctor. This next question is on Twitter from IndieChick986, and it's a question I get tons of times. She tweets, is it safe to be on the pill indefinitely? Well, long-term studies show that for those who are generally healthy and don't smoke, indefinite use of oral contraceptives, whether they have just estrogen and progestins, they can, or progestins only, you can use them indefinitely, meaning all the way through into menopause, because it's a continuum, ladies. This will not have any adverse effects on future fertility. It can be a great way to regulate your periods as you go through menopause. But again, for some who are smokers, there may be risks of blood clots. So you have to be very, very careful to do this with the doctor's guidance. Several women have asked me about feeling a tiny water balloon on their vaginal wall. That's actually what we call a Bartholin's duct cyst. And basically what happens is the Bartholin's gland secretes a lubricant that keeps the vagina lubricated. Now, if this duct gets plugged, it can become a cyst or even an abscess. That lubrication can get backed up and become an abscess. If it's just a cyst, sometimes with a warm bath, it can pop on its own. But if it forms an abscess, it can get hot and angry, and then you need medication, and it may even need to be drained. So really, really, really important. And next, I know you all wanted to know whether or not a yeast infection can be transmitted sexually. Yeast infections are not sexually transmitted diseases, but some doctors believe if you have overabundance of yeast, that means it's just tons of yeast down there, which nobody wants, it can sometimes be transmitted sexually, and some men can get itching and redness around their penis. And next question, one of the most important and that I've spoken about so much is if you're sexually active, when should you get tested for STDs? Well, basically, anytime that you're sexually active, you should get tested for STDs. Which ones? Gonorrhea and chlamydia are huge for women because they can cause lifelong effects. So remember, it's not just about HIV, it's also about hepatitis and syphilis. HIV testing is recommended for all pregnant women. A lot of pregnant women don't realize how important this is because antiviral therapy can actually improve mother's health and lower the chances of passing HIV to infants. This is huge, huge important information. That's why we test all pregnant women. Other than that, the tests are recommended if you're sexually active or if you have more than one partner. Remember, you have to know your status. Getting tested is huge. Finally, should a woman have a prescription on hand for the morning after pill? Listen up, this is really important. Those under 17 should have a prescription on hand. The Health and Human Services Director recently overruled the FDA to prevent emergency contraception from being sold over the counter to girls 16 and younger. This is really big news, so it's really important to have a prescription in hand just in case that condom breaks, all right? Did you hear that? You heard it here.